Heimdall Health is a medical device company that specializes in diagnostic instruments. Currently, we are developing the mapping otoscope, a reliable device that detects middle ear infections. Middle ear infections, also known as otitis media, is the presence of fluid inside the middle ear. Approximately 80% of kids will have at least one episode of otitis media before they reach the age of 3, and 40% of kids will have 6 or more recurrences before they reach the age of 7. Common symptoms include ear pain, hearing impairment, and vertigo. However, an alarmingly high misdiagnosis rate of 50% among pediatricians can lead to more serious complications like bacterial meningitis and even brain abscess. That is why it is also the #1 reason of overprescription of antibiotics in children. Current pneumatic otoscopes allow for the visualization of eardrum compliance in response to an air pulse stimulus. How much fluid is built inside determines how much the eardrum actually complies. However, these devices present this high misdiagnosis rate due to the lack of quantifiable information it provides, leaving more subjective decisions for the pediatricians, especially when the pediatrician only has 2 to 3 seconds of procedure due to the patient's lack of cooperation.
Therefore, we are developing the mapping otoscope, an innovative pneumatic otoscope capable of providing real-time quantitative feedback to the pediatrician during an exam. It functions by projecting a grid of dots onto the patient's eardrum. The changes in the dot grid caused by movement or lack thereof of the eardrum due to an air pulse stimulus are detected by the camera and converted into compliance measurements using the device's software. These measurements are then displayed to the pediatrician using the user interface for them to make a more informed diagnosis. We have a dedicated team of bioengineering graduate students, a business graduate student, and an ENT specialist working on this device, and we believe that the development of the mapping otoscope will set the standard for diagnosing otitis media in the future.